Hi, and welcome to the Neuromuscular Junction with Dr. Mark Tarnopolsky. Today we're going to talk about coming to terms with terms. What we mean by that is that when we're talking about different types of exercise, there's a lingo, which if you don't understand it, you won't really know how to do exercise properly. So there's really three main types of exercise. The first is called resistance exercise. Resistance is something that you do with lower repetitions and higher resistance. So things like weight training, plyometrics, therabands, those would all be examples of weight training. And the goal with weight training is to improve muscle strength. So generally what you're doing is putting the muscle through some stress, and that stress leads to what's called muscle hypertrophy. But independent of hypertrophy, you can also get increases of strength, but usually the two go hand in hand. The second main type of exercise is endurance exercise. And this is what most of you think of, for example, if you're going for a run or a jog or bike or cycling. Those are all examples where you're going at a lower intensity but for a longer duration. In general, with endurance exercise, we increase the delivery of blood flow to the muscle. We increase the mitochondria, which is the powerhouse of the cell. We also improve cardiovascular function, so the heart's ability to pump. And that is reflected in something called the VO2 max. So in the way in which strength is your measure of your muscle strength, and that's what goes up with resistance exercise, with endurance exercise, it is your oxygen consumption, which is your VO2 max, which improves. So at rest, our body consumes about 3.5 milliliters of oxygen per kilogram body mass per minute. With maximal exercise, that's going to go up as we consume more and more oxygen. So how we measure this usually is on a treadmill or a bike. We slowly ramp up the intensity and see what's the maximal amount that a person can consume. People who are top sport endurance athletes, such as trail runners like Kilian Jornet or a cross-country skier like Johannes Kleibo, may have VO2 levels over 90 milliliters per kilogram per minute at maximum. In our patients with muscle disorders, the weakness from, let's say, a muscular dystrophy or the impairment in the mitochondria in something like a mitochondrial disease can massively lower VO2 max. In fact, some of our patients who have MELAS syndrome, a type of mitochondrial disease, have VO2 max levels that are around 7 or 8 milliliters per kilogram per minute. Why that's important is it's estimated that you need about 12 milliliters per kilogram per minute just to do daily tasks and daily activities. So these people are essentially at their total maximum capacity, just doing things that most of us take for granted. So the goal of exercise in resistance is to increase strength so that your daily activities are easy and you're not taxing your muscles as much for everything that you're doing. And in endurance, when you're going for a walk, when you're going to do groceries, whatever that might be, where you tax the aerobic system, we want to increase that threshold. These can be done safely, and that's really the goal of these videos. But we have to understand some of the terms in a bit more detail before we can understand our videos on different types of endurance and resistance exercise. So with resistance exercise, we usually define things in reps and sets. So reps, pretty straightforward. So for example, if I'm lifting, that's 1 repetition, 2 repetitions, 3 repetitions. All right, so that's what we mean when we say reps. Sets would be if I do 10 reps and 3 sets. So the first set would be 10 repetitions. I would wait, go do something else, and do my second 10 repetitions. That would be set number 2. Come back, do the third one. That would be my third set. And there's many ways of dividing these things up. So the way that we would like people to do their exercises, to organize them in a circuit. What we mean by that is that you would use, for example, your biceps first. So your first set is biceps. Then you would move on to a second activity that didn't involve the same muscle. So you could do core, for example, some crunches. Then the third set that you would do would be your quadriceps, and you would go back to the biceps. So by the time you're back to the biceps, the muscle's rested for about 2 minutes. That's called a circuit, and you would go through that circuit 3 times, which would give you 3 sets. Generally, we would do 10 to 12 repetitions for most activity. With patients, we want to start off with higher reps, maybe 12 to 15 till your body gets used to it. But if you cannot do an activity 10 times, if you can't do 10 reps, too heavy. And therefore you may cause damage to your muscle. So always keep that in the back of your mind. No matter what activity you're doing, if you can't do 3 sets of 10 reps, back off the intensity or the weights so that it is a little bit easier for you. Now again, you don't want it too easy that you could do 30 reps, no problems. You generally want that 12th, 13th, 14th rep to be, okay, that's it, now my muscle's tired. So when you're at 12 to 15 reps, that's about 60% of your 1 repetition maximum. 1 repetition maximum is the maximum amount that you can lift. So if you do it once, you can't do it a second time. So every few weeks to a month, you should just recheck what that maximum is and generally be doing those 3 sets of 12 to 15 reps. That's usually a very safe way to increase your muscle strength with muscular dystrophy. But even there, we want to start off very easily, listen to your body, and get used to the activity. Usually you'll have a little bit of discomfort in the muscle, often 24 to 48 hours after you exercise. That's called DOMS, or delayed onset muscle soreness. That's another term to remember. Now, it's normal to have a little bit of discomfort. What we don't want is for the muscle to be really sore where you can barely move it, or it's stiff and you can't even straighten out your arm. That's causing damage to your muscle. Of course, if you do have dark urine, brown, black, tea-colored urine, you've really damaged the muscle. But if you follow our steps to safe exercise, that shouldn't happen to you. But again, if unfortunately that does happen, make sure that you seek medical attention for sure. So we need to progress exercise so that it continues to stress the muscle. So as your body gets used to it, and you're doing 3 sets of 12 to 15 reps, and you recheck your 1 repetition maximum, hopefully you'll see that it goes up a little bit, then you can increase the amount of weight that you're doing or resistance. Depends on what type of resistance activity you're doing. It's either an extra free weight, another pin, for example, in a machine, or a different colored TheraBand. And we're going to go through those in all of our subsequent videos so you'll know how to use all of these bits of equipment safely and effectively now that you're starting to learn what the different terms are. So with endurance activity, the VO2 is something that we measure with a special machine that tells us how much oxygen we're breathing and how much oxygen is coming out, and the difference is your oxygen consumption. Now, of course, most of you won't have access to that sort of a machine, but fortunately, our heart rate is something that we can use. So with the heart rate, our resting heart rate for most people is around 70. As we exercise, our heart rate goes up to deliver blood to our muscles, and that's where the oxygen and food delivery comes from. And the heart rate is roughly proportionate to your VO2. So for a young, healthy athlete, their maximal heart rate would be around 200. And generally, if you look at 220 minus your age, that gives you what your maximal heart rate is. And that's an important number for you to have in your back pocket because you don't want to be getting too close to that level. If you're at 80 or 90% of your maximal heart rate, you won't be able to talk, and that's going to be pretty intense, and you're probably not going to last for too long. What our goal is to be able to tolerate at least 30 minutes of exercise 3 times a week, and that's a good goal to get started with. For example, in our myotonic dystrophy study, after exercise 3 times a week for 35 minutes on a bike doing endurance exercise, we increased fitness or VO2 by 31%, which is pretty dramatic and very impressive, and certainly led to improvement in various functional tasks and quality of life. So when we were thinking about exercising very practically, even if you don't have a heart rate monitor, you can use things like your conversation. So when we're trying to get to that sort of 60-70% of VO2 max, that's about where you can no longer carry on a conversation. So you should be able to converse with someone. You might be a little short of breath, but you should be able to carry on a conversation. That's a good way to sort of get a rough estimate. If you do have a heart rate monitor, which most people can get, even some now are as cheap as $40 or $50, all the way up to $500. And the heart rate, you can then aim to look for around 110 beats per minute to 130 is a good sort of range for most people to derive the benefits from moderate intensity continuous exercise training. Another type of exercise that some of you might have heard of is called HIIT. HIIT stands for high intensity interval training. My good friend and colleague, Dr. Marty Gabala, was really the person who really popularized this and did most of the original research. For more information on that, you could look at his excellent book called The 1 Minute Workout. So what Marty and others have found is that if you do high intensity exercise, take a break, intensity exercise, where you're pushing yourself to the point where you can't speak, so you're getting up closer to your maximum heart rate, and you do that in set intervals, there can be adaptations which are more like endurance versus resistance training. So we tend to get more of the mitochondrial enhancement, increased VO2. Now, people might say that might be too dangerous for people with different types of exercise, but more and more folks are finding that with diabetes and different types of muscle disease, some folks can perform HIIT training. So just so you know what it is, most of what we're going to talk about in our videos is going to be the resistance and the endurance type of activity, which has been tried, tested, and true. But just in case you've heard of it, that's what HIIT is. So one of the things you would do, for example, is if you're on a bike, warm up, and then you would push harder to the point where you can't talk, ease off a little bit, push a little bit harder, and generally you're looking for sort of 30 seconds to 1 minute of that high intensity, interspersed either with total rest or a lower intensity activity. So obviously you don't want to jump into that until your body's used to it. And certain disorders like McArdle disease or Tarui disease, which are some of the glycogen storage disorders that we're going to talk about, we wouldn't recommend that type of activity. So hopefully you've come to terms with some of the terms that we're going to be using in our videos. So please check out some of the other videos that we have, either disease specific or exercise specific, so that you can exercise safely and healthfully. If you or anyone you know has a neuromuscular or neurometabolic disorder, please subscribe to our channel. Ring the bell if you want any notifications of other upcoming videos that we're going to be producing. We're going to try and come up with new videos and topics at least every week or 2 weeks. So please leave some comments in the comment section about things that you may want to learn about in the future. So thanks so much for watching, and we look forward to seeing you in our next video.